Hi, Dr. J. Sordean here again, talking about your brain. So we have here the brain, which is inside the skull. The brain, which I'm rotating here sideways, you can see we've got here, this is the brain stem, which connects up to the spinal cord. Now I'm going to use a different model to show you the spinal cord as it, we don't have a brain in this particular model, so we're going to remove the top of the skull here. You can see we're removing the skull, and people don't have this metal pole sticking through their brain usually, or their spinal cord. But here, this is the same thing, the brain stem that I was showing you before. This structure right here, the brain stem. So here's the brain stem with the blood supply, these red things, this is the blood supply. And the blood supply comes up into the brain in order to feed it. It comes through this area, which is called the foramen. Then we have the skull sitting on top of the neck bones, the vertebra here, vertebra. And you can see here it pivoting back and forth on the vertebra. Here is spinal cord. Just right up inside there, inside the skull, is where the brain stem is. Because the meninges surround the brain stem, it forms 3 layers totally surrounding this, totally going down through the hole, the foramen here, down in to the vertebra, through the spinal cord. It also connects up within the spinal canal somewhat with the vertebra and the spinal cord. So the meninges are all surrounding, totally surrounding the brain stem, and as I mentioned before, they completely surround the brain, and they create an envelope, a 3-layer envelope surrounding your brain, brain stem, cranial nerves, which give the sensory input that we use to understand the world, and then all the way down on the spinal cord surrounding that. So anytime we have meningeal torquing, it can actually tug on the nerve roots, as if this is the foramen, nerve root coming out of the hole from the spinal cord. It could actually be tugging on this area as well, which will create sensation out into the body. And then there's also nerve impulses going back in from the peripheral nerve and from the nerve root, coming in and going up through the brain stem to the brain, where the brain interprets that as pain or cold or heat or some other sensation. So we can get a variety of different unusual sensations that are not because, for example, we're touching a burner or we're being pinpricked. We can have these sensations because there's actually a torquing or a tugging of the meninges as it surrounds a nerve ending. I don't mean a nerve ending, or as it surrounds a nerve root. And then that can create impulses going to the brain, suggesting that we are sensing something from the external environment, but in fact it is actually an anomaly. It is something which is not correct. It is something which is created by the nervous system and not from the outside world being interpreted by our nervous system. This is why in the meningeal compression conditions that we talk about, many people have a wide variety of very, very confusing symptoms which do not fit a standard neurological. Just put the skull back on there to protect the brain and my friend here. So many people may have this kind of a condition of meningeal compression that is influencing the brain stem or the surrounding, the peripheral nerves, the nerves as they exit from the spine here. You can see them coming out. It's also the meninges surround these, so they can tug, and then it can send a message up through the brainstem, through the skull, into the brain. And there can be a wide variety of misunderstood information coming from not only the external world, but from our internal world gone awry. This is Dr. J. Sordean explaining to you very briefly what meningeal compression is, the significance it can have on your life, and reminding you that I can work on your brain without having to open up your head. Thank you so much. This is Dr. J. Sordean speaking to you from the Neurologic Relief Center of Berkeley, California. Talk to you again soon. Thanks. Thanks for helping. No problem.